Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hey, Tom.
Hey, Parker. Good to see you.
Good to see you, as always. Well, here we are doing our second episode of the podcast. For anybody listening, what we're doing is, this should be Chapter 2, Assessing Startup Costs in our practice topic. So we're still, last week we did getting started with your private practice. This week we're looking more at assessing startup costs and what that might mean, and trying to cover the basics of what financial considerations need to be made when you're starting up your own practice. So I have a list of questions here that I think would be great to ask you. And the first one is kind of the, I think, foundation of the whole question around startup costs and starting a practice, which is, how important is a business plan in the early stages of starting a practice, and what key elements should that include? So what are your thoughts on that, Dr. Tarshis?
Yeah, thanks. Thanks for the formality with the Dr. Tarshis comment. There's a couple of different pieces around the business plan piece. And I will say in full disclosure that when I started my first business way back when, I did not have a business plan created before business operations began. I think there was a small effort towards putting together a budget, but it was definitely a mistake to not have been a little more thoughtful around the business plan. And we can talk about how that caused some pain later on in the process. On just a logical level, thinking about your business, your costs, are you going to expand? Is it going to be just yourself? And putting together the business plan, covering all aspects of your business, but especially the financial aspects, which is the budget part of the business plan, is something worth the time and effort to do, and will save you a lot of hassles down the line. The second you do decide to apply for some type of funding, or a loan or a grant or anything, they are going to ask you to see your business plan and to include a detailed budget in that. So having that ahead of time for when it will come up that you might need it makes a lot of sense. That's the second piece, is that you will need a business plan for lots of different reasons while running your practice, other than just it's good to be very thoughtful about what you're spending your money on and what you hope to do with your own business.
Got it. Yeah, I mean, that makes a lot of sense. It makes me think about project management and how there's a bunch of different ways to approach a project, but usually the best projects come down to planning something out and planning out, contingencies and what all the individual steps are. But it's so easy to start a project without doing something like that. And a business can be very much in the same way, where you can kind of just get going and just get started. But if you want to, in the case of how you're describing it, cover all of your bases with taking funding or things like that having a business plan is an essential element of that whole pie, and might be a bit easier for you long term going into the whole process of having your own startup. Having your own practice, I should say. Sorry.
Startup is okay, right? It's a startup business for anyone. I mean, there is an issue with people in general, and if you look at in personal finances, and Parker, I don't know if you've done this, but most people don't even budget their personal finances or have a personal budget plan or a quote business plan for life. I'd say especially in as a mental health clinician, in graduate school or getting your PhD or through medicine, we do not receive enough training on business aspects or running your own business or finance. So, those factors coming together and make it a challenge or maybe scary to put together that business plan. I don't know, like Parker, do you have a personal budget?
Yeah, that's a great question. I do, and I didn't start having my own personal budget and financial plan and accounts and all of that good stuff that I've come to learn are super crucial. I didn't come to have that stuff until maybe 3 years ago when I had somebody kind of reach out wanting to help. They were looking for, a financial advisor looking for people who, needed that kind of help. And I learned a lot from that process, but it's interesting because it does drive a lot. Now that I have all of that stuff, it does drive a lot of how I choose to make big decisions. And based on applying that from my personal life to the idea of running a business, it makes a lot of sense that there's a lot of parallels there, that your life almost is your business. Though it definitely, I'm sure it gets a little bit more complicated, or I guess frightening, for lack of a better way of putting it, when you're the one that's financially responsible for providing for other people that work for your business. And it's not just your life, it's, a bunch of people's lives.
Good. Yeah, good point. And again, if you're going to be a solo practice and just run your business on your personal tax returns as a Schedule C business sole proprietor, and you never plan on taking money or grants or loans from anyone, you definitely can get away, right, with not doing a business plan or a business budget. You can kind of see your patients and pay your bills, and the money you have left over after that is in your bank account and you pay taxes on it. I think that it is still so many positives to being thoughtful about your business plan and budget that it makes sense to sit down and do that. For tracking average revenue, how many patients do you want to see? Don't forget about vacations and holidays and how you're going to handle those situations. So, but yeah, definitely I know very, very many businesses and small practices that have never done a business plan or budget.
So what exactly, what would the financial requirements be for starting a practice? Like if somebody today said, I want to start a practice tomorrow, what are the things that they're going to need to pay for, and what are the ways that they can manage those costs? I know we've talked about maybe getting like a loan from the bank or something like that, but what all fits under that umbrella?
Yeah. This is where the business plan and budget comes in, because depending on what you're planning to do will help you figure out those startup costs. For example, if you want to rent a space and you need to furnish it, you need to make sure your licenses, you need to have if you're going to do telehealth, you need to have a computer and technology set up. It's pretty easy to put down the cost for all those items and then know what those startup costs will be. Given the advent of so many telehealth services,
right,
we're so lucky to be in this field that most people already have a computer and a setup. So your only startup costs for doing a business are getting whatever licenses you need, getting your malpractice insurance, and paying for the telehealth video solution, which could literally be less than a couple $100. So
it makes me think about internet service provider. In your experience doing telehealth visits, is it worth it to spend a little bit extra money on having more high-speed internet to make sure that's as stable as possible? Or I don't know. Maybe you already pay for the high-speed internet. Yeah, it's just a question of whether it's right for you to consider, a standard internet plan being good enough in order to support that, or if it might be worth to spend an extra few dollars a month to support your business. Given telehealth is can be such a crucial element. Yeah.
Yeah. No. Yeah. Absolutely. And this is one thing we can thank the pandemic for a little bit, is that so many people working at home now has pushed costs down, actually, and has increased some of the stability, I feel, of internet service providers. I would definitely splurge for whatever the best internet speeds are if you're going to be doing a telehealth practice. And often it's a good point to bring this up, because I'd say, we often get very good download speed from our internet service providers. And they're very keen on this, because if you're streaming shows, you need to have good download speed. But as a mental health provider, you need to pay very close attention to your upload speed,
Right.
which is the speed you're sending out video. And on some level, the upload speed is more important than the download speed, because you want to make sure your patients don't miss what you're saying or don't have a choppy connection from you. They're just not going to come back, or they're going to miss something important in their treatment. So theoretically, having 15 or 20 megabit upload and download speed should cover very high definition video transmission. I would say in experience, however, being at 100 megabits per second upload and download is much safer, and there are plans that can go far above that,
Right.
and usually not at great expense. I think for our nonprofit agency right now, our Comcast internet bill is $85 a month for very fast speed, and hopefully it's similar around the country to costs like that.
Gotcha. And that's something that you can write off as a business expense?
Yeah, so there's, and it's interesting that you use the term write-off. So it's not necessary, if you're doing the Schedule C sole proprietor on your taxes, it's a business expense. It's not really a write-off like your mortgage,
Right.
or standard deduction, right? It is a legitimate business expense, so that's going to reduce. You don't have to pay taxes on that business expense. I'm not an accountant, but the basics of the premise is you have income and expenses, and what's left over is your profit. And out of that profit is where you pay yourself if you're a sole proprietor. So everything that you spend, office, furniture, internet costs, if you're just going to use your own cell phone for your business, that becomes a business expense as well. And so all of those lower the income for your business, and you don't have to pay taxes on that.
That's I just learned something new, and you telling me that this is something that I have. I work for the company as product manager, but I also do a bit of design for the company as well, and I am friends with a lot of other local designers, many of which work on a contract basis, and they have their own self-employment taxes that they have to pay. I'm based in the state of Virginia. It's actually pretty easy to start up your own LLC, and we often find ourselves having conversations about what is something that is a business expense versus not. And it's just been an interesting learning process talking to anybody and everybody who's started a business and learning this is something that counts. Where I get confused is, when I'm working at the coffee shop, is my coffee, does that count as a business expense? I'm not sure. I'm no expert on that, but no, it's its own realm. Hopefully my personal naivete of not having started my own business is helpful for anybody listening who's maybe having similar thoughts at the idea of doing their own.
Yeah, and I'd say taxes on some level can be subjective. Or, for example, Parker, I'm sure there are people who go work at the coffee shop and deduct the cost of their coffee as a business expense. And the logic could theoretically be, well, if I was at the office and I bought coffee beans and a coffee maker from Amazon on the company credit card as something we have at the office, yeah, that's definitely a business expense. So therefore, why doesn't the coffee I order at the coffee shop where I work count? I think the IRS would, if you got audited, they'd probably say, sorry, that doesn't count your coffee that you've purchased. If you're meeting a colleague for a new business venture at the coffee shop and share coffee and a sandwich, there is a meals deduction.
Oh, interesting.
Where you get, in general, can take half a deduction, 50% of the cost for your meal or coffee if you're having a food or business type meeting.
Interesting. Okay.
But yeah, it's a good question and comment. And there can be a whole other episode on taxes and some of the benefits that you get. And if you are going to be self-employed, taking advantage of things for health insurance, for retirement accounts, being aware that if you're self-employed, you don't have an employer covering the 7.65% of your Social Security and Medicare tax. So you're going to have to pay that extra 8% of your whatever you earn is immediately going to cover that piece. And it's important to be very aware of that.
Yeah, that was something I learned pretty quickly. Having been self-employed in the past, it's different tax ball game. Definitely something to be making sure that you're all up to speed on, because you will end up having to pay that extra 7.65 to 8%. That you're not used to being taken out when you're working like a regular W-2 position. Right.
And just the final comment on that is, at any job you work at, you have to pay Social Security and Medicare taxes. The current rate is 15.3%. If you work for someone, the employers pay half of that. So the half of the 15.3 is that 7.65%. And so every dollar you earn, immediately 15% goes to Social Security and Medicare. And then you have to pay your federal and state taxes on top of that. Depending on your tax bracket, federal could be another 20 to 30% going to federal taxes, depending on the state you live in. I unfortunately live in one of the highest state taxes places, California. If you're lucky to live in Texas or Nevada, that's zero for you. But so if self-employed in California, and if you're a physician, or even as a psychologist or MFT, you tend to be a higher earner. So 15% Social Security, Medicare, let's say 25% federal, and then 10% state, you've just wiped out 50% of your income going to taxes. So whatever expenses or deductions you can do pre-tax, you want to take advantage of that.
We're talking a lot about unexpected costs that might come from starting up a practice or just a business in general. Do you have any past history, I guess, or any examples of an unexpected cost that you never expected that might be something to anticipate for somebody else?
Yeah, I'd say one of the business, before we get to that, I'd say the strategy I used when starting the nonprofit entity in 2007 was I took a half-time paid position with the county. So I knew I would have some income and would get some benefits covered while I was building up the practice. And that was a great way, and I think it's a great way for all mental health clinicians, right? The reality is that it takes time to build up your practice, whether you're going cash or taking insurance. There's things you can do that we'll talk about to get clients and referrals faster, but you're not going to be immediately full the day that you start your practice. So there are a lot of opportunities now, thanks to telehealth groups all throughout the country, that people can sign up with and work as a contractor or employee to have that guaranteed income. And if you need to get benefits covered and don't want to get that set up right away through your own business, getting a half-time job or similar somewhere else is a great way to make sure you can pay your personal rent while you're building up your business. The problem I had by not making a business plan was, we got to a point where I was full in the practice and had one therapist on board, and then they started part-time also, and then they were full. And then we had started generating a wait list for the clinic of people who wanted to be seen. And then in my mind, I thought, oh, hey, I've got 50 people on the wait list. Time to go hire more employees to see these patients on the wait list.
Right.
So I posted, and there's several mistakes here, but I posted for a W-2 salaried position, and I hired another physician. And physicians can be expensive employees. So if you go right out and hire a full-time physician, that's a lot of money that you have to put on that person's paycheck. And my assumption was, well, all these people on the wait list, that will fill this person's schedule. But when I went back to call all the people on the wait list, and this is what happens in mental health, and this was youth mental health, wait lists don't tend to translate into immediately scheduling for appointments, because it's always the time to catch patients is right when they call.
Right.
And so I had falsely assumed, hey, I can fill this doctor's schedule, no problem. And then when I went back to call those 50 patients, maybe 3 of them took appointments. And so then I had a full-time employee generating not much revenue, but I was still responsible for their salary. That had not been thought out in a business plan. That was not part of the budget. And that caused some serious hardship, for many months until that employee's schedule got full. So that was a unexpected expense that if I'd been more thoughtful about the business plan, could have maybe avoided it. But I certainly learned from that experience.
Yeah, I mean, a lot of it is we can read as much of this stuff about, or we can read as much of this as we can in a book or listen about it on a podcast. But some things are just learned through experience of doing it and taking the chance. And I mean, it sounds like that was a really tough experience in the moment, but all in all, panned out positively in the end.
Yes, yeah, it did.
So what advice would you have for somebody who they're thinking of securing any kind of funding or financial support when they start their practice? Like, are there any specific loans or grants or investor options that might be well suited for a healthcare practice?
Yeah, and depending on starting nonprofit versus for-profit entity versus sole proprietor, there's different options potentially available for each. I'd say the 2 options I've done more than 2 options, but for your standard, if you're starting as not a sole proprietor and you're maybe going to set up an S or a C corporation and make a real business for your practice, which I think has a lot of advantages. The SBA, the Small Business Administration, run by the government, does help guarantee loans for entities. This is not for nonprofits, so this is for-profit small businesses. It's a great program that makes banks feel comfortable lending money to small businesses. And you can often go in and get a $150,000 unsecured business loan. And what unsecured means is you don't have to back it up with your house or put your own personal assets on the line.
Oh, okay.
And then that's, in case you fail miserably, the loan is forgiven. Banks are willing to do that because the government will back up the bank's loan for up to that $150,000 amount. And in fact, I'm hopefully just closing on another 150,000 unsecured small business loan because it's just a great way to bring in some revenue at pretty low interest rates. There are actually, so if you want to go, don't want to work as a contractor somewhere else and want to throw yourself fully into your business, or you've just graduated and you need some money, you want to make sure that you have money to pay yourself with, looking to get a SBA loan is a great option. There are lots of other lenders out there who are eager to lend to business owners with advanced college degrees. I'd say there are people that if you have a decent personal credit score, that there are many other options to look to for loans for starting a business. It won't often be as good interest rate, and often those loans will need a guarantor or need to be secured. But yeah, it's very easy to just Google, startup business loan, and you'll see a lot of vendors willing to, give you money.
Well, yeah, no, that's all really, really great to hear. My last question that I have is pertaining to an actual office space. So we talked about how easy it is to start a telehealth practice, especially now post-pandemic. But for those that are considering having an office space doing in-person visits, how does the choice of location affect costs, and what kinds of financial considerations should they be taking into account when it comes to choosing an office space? I heard you mention renting a space and getting furniture. What's been your experience with all of those moving parts in a physical space?
Yeah, no, really good question. And this is an area that's changed drastically since 2007 with the advent of telehealth and then the pandemic. What we've seen now post-pandemic is that the majority of patients looking for therapy would actually rather have in-person services. So there are advantages to telehealth, like there's no commute to get to your therapist or psychiatrist's office. It's can be a convenience if you're running late. But when asked specifically, do people prefer in-person services or telehealth services, it's a resounding in-person services. And in fact, now with all the new telehealth companies, including companies being owned by insurance companies, there is a push for people to be using telehealth only for mental health services.
Oh, interesting.
So but that is not what consumers want. So getting a office is actually a good business move at this time, I would say. Unless you're in a very rural area, or if you live in if you want to do an exclusive cash practice, but you live in an area where there's not a lot of people who could afford themselves or their children going to a cash practice, then having a telehealth practice where you market to more affluent cities could be a strategy. But I was just speaking with a young doctor who's going to start their private practice, and they had come to that conclusion that, a lot of people have said, it's so easy to see a mental health professional now, but they're all through telehealth. And he had been meeting a lot of people who really wanted to have an in-person experience with their therapist. So they were going to procure an office in a, not a huge metropolitan city, but a reasonably sized metropolitan city, so that they could do in-person appointments as well as telehealth, which you can do from anywhere.
Right.
I think especially because this doctor was going to start with a cash practice, that you want to serve those people that want to come in person. And then especially if they're paying cash, you want to look to meet the needs of the clients and the people who are desiring that service. I'm actually hopeful that one day doing in-person services will lead to higher reimbursement rates from insurance companies. That hasn't happened yet. In fact, there was a little bit of a fight to get telehealth to pay the same as in-person services, and that battle is pretty much over. But then I think the next phase in mental health treatment is, hey, if you're a provider that actually sees people in person, you're going to get reimbursed more than if you're just seeing people over video. So
go ahead.
Oh, yeah. And I was just going to say, especially for kids or people working with kids, and some data support this, that below a certain age just is not as effective treatment. And so it gets difficult, I think, if you're seeing kids under age 10, not always, and some people are better than others, but it gets harder to engage people in treatment. And we know the first predictor of successful treatment is, can you engage with your patient and establish that good rapport?
Right.
So if you're seeing kids, it gets more important to have that physical space.
Yeah, I'm glad you brought up the data element of that, because that's what I was going to say earlier was, it's likely something that the research will have to, support over a long period of time. We're still very kind of fresh in this. Telehealth is, we've been doing in person since, the advent of just mental health practice. And so, yeah, with telehealth being such a new thing, it's, we'll have to wait and see what the data suggests.
Yeah, and this is the whole, right, this is highlighting a problem with this field that we will be talking about often, which is we don't have those great metrics on successful treatment. So again, we're battling, how do we know our patients are getting better in this field? And because we just don't have great metrics or tracking, it makes it hard to do studies around what is getting better outcomes. Is it in person or is it telehealth? And Parker, we worked on some data analysis for intensive outpatient programs showing at the start of the pandemic, it was pretty similar. But then as time wore on, the results stayed similar for young adults, but for teenagers, after, I forget the mark of the pandemic, but definitely a year into it, they were just kind of over some of these long sessions and wanted to return in person. And the data was supporting the outcomes were not good. Yeah,
and we've done research in the past as well that supported that the less that we were on our electronics, the better that we were doing in general in our, I really mean the patients. The patients in general were doing better on average when they were using their electronics less. So it's definitely something that, telehealth, electronics, the data was slightly different at the beginning of the pandemic because it was just a complicated time. I mean, I was in grad school at the time doing research, and all data at that time just kind of went out the window because every study that came out for the next 2 years had to have a COVID spin on it, because that was just the nature of the beast, because that's what we were all dealing with. So yeah, it's right. Been an interesting shift for sure.
Yeah, and I'd say that there are strategies for getting an office that can be very cost saving. So as I mentioned, you're not going to be full right away. There are often buildings that cater to mental health professionals, and there are often one of the advantages of working for yourself is you can often work part-time or less hours and make as much as you do working for someone else. So there are many people looking to sublet their office or who work part-time that would be happy to share their office with you. And there are just so many people I know who, when they're starting off, hey, I'm just going to start Thursdays and Fridays, you almost certainly can find someone willing to sublease their office to you for a couple of days a week to get started. Personally, the other nice thing about this field is renting a small office is not that expensive. Even in the expensive San Francisco Bay Area, we have a couple small offices. One is $550 a month and the other is $680 a month.
Oh, wow.
Which is, it's still hundreds of dollars, but compared to other businesses you have to start on your own, when your rent and all your initial furniture, if you're up for doing a little Craigslist or IKEA and putting stuff together yourself, usually $1,000, certainly less than 2,000, can get your office procured and furnished and set up, and then you're ready to go. And there is something to your mental health that, and I'm not as sure on the data as this because I haven't read all the studies, but it does look like having an office to go to as well as flexibility to sometimes work at home is what's going to be best for everyone in their work-life balance who has that luxury of doing some work from home. And we're very fortunate to be walking distance to our offices. So taking a little morning walk to go to your office away from your home, even on days you're doing all telehealth and could just work from home, it feels good to get out of the house and do that. It's good for self-esteem.
Yeah. I mean, so for me, speaking as somebody who does work from home, I work in an office, but I keep that office. It's, on the opposite side of the apartment from my bedroom. So for me, when I'm not working, I like to keep the office door closed because that's a headspace that is reserved for that room. And when I'm out of that room, I have set a boundary that I'm not working. Though, to your point, I do like to go outside to work sometimes. Maybe I'll go to my balcony. Maybe I'll go to the coffee shop down the street. Maybe I will work from the couch sometimes, just to have a little bit of variety. I think we all kind of need that from time to time. But I definitely, in general, agree with the idea that it's best to have a separation, like a mental separation between your office and where you work and your space in which you relax in.
Very good. Yeah. Yeah. And it's just, again, compared to starting up any other business cost, we're very fortunate in this field as mental health clinicians to have around the lowest startup costs possible for any business. And so it's something that taking advantage of that, putting together your budget and business plan, it is very possible with the right thoughtfulness and prep that just having a few $1,000s if you want to get an office space, or a few $100s if you're going to be telehealth from home, you can get rolling and be profitable your first month of business, which is also unheard of when starting a small business. So we're very lucky to be in this field and have those options. It doesn't mean to be careless or not be thoughtful, which I've learned the hard way, but if done correctly and with the right thoughtfulness and planning, and hopefully this podcast or just reaching out to me personally, happy to help people avoid those mistakes. And get people out there providing mental health services. That's our goal.
Absolutely. Beautiful. I love it. Well, last time we ended off with a mental health business moment of the week. Do you happen to have one in your back pocket for today?
Let's see. Thinking about what's happened. Well, I mentioned that I was about to get another little small business association loan. And I'd say that, whenever one of the downsides to working with the government is there's a lot of repetitive document filings that you have to send out. And so one of these little hassle moments was, they wanted a copy of the business lease agreement to show that, I'm not sure why, but to verify that I have this address. And so I sent in the lease agreement, and then the bank wanted to have, at the end of most lease agreements, there's usually a clause that, you can continue the lease forward if it's agreeable to both parties, and then landlords are happy to keep people. So the lease sort of stipulates that. but the bank wanted to have it more formally written that the lease could be extended for another 3 years from when it expires in October. And I wrote back and I said, not much really happens at the office. There's not clients coming into this office for this business. And they wrote back, yeah, we understand. And if you were switching to a home office, you can totally do that. And it doesn't affect the loan. But we still need a note from your landlord that you can extend your lease 3 years. So fortunately, I was able to reach the landlord and they were willing to craft up an amendment that looks like that. But it was one of these sort of, it's not logical what's being requested. So, but you're not going to go there and confront the federal government
right.
and the big banks on their policies. So just sort of take a deep breath and know that the world is like this and do what you need to do.
Good advice. Good advice. All right. Well, this has been fun. I think now would be a great time to wrap things up. Thank you for joining us on the Sit and Stay podcast. This week's episode. We'll be sure to get back to you next week and look forward to the topics that we discuss then.
Very good. Thank you, Parker.
All right. See you later, Tom.
Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.